What is the link between Afib and ischemic stroke? Imagine your heart as a well-coordinated pump, sending blood smoothly through your body. When someone has atrial fibrillation, or Afib, this rhythm gets all out of sync. The upper chambers of the heart, called the atria, start quivering irregularly instead of beating normally. This irregular beating causes blood to move sluggishly and sometimes pool in the atria. When blood isn't flowing properly, it can form clots, kind of like tiny blood clots that stick around in the heart. These clots are dangerous because they can break loose and travel through the bloodstream. If a clot makes its way to the brain, it can block a blood vessel, cutting off blood flow. This blockage causes an ischemic stroke, which is the most common type of stroke. About 20% of ischemic strokes are linked to Afib, making it a major risk factor that can be changed or managed. The risk of stroke in people with Afib is about 3 to 5 times higher than in those without it. This risk increases with age, especially over 40, and is higher in people with high blood pressure, diabetes, previous strokes or mini-strokes, heart failure, or other heart problems. The main reason for this increased risk is that the irregular heart rhythm leads to blood stasis in the atria, which encourages clot formation. These clots can then travel to the brain and cause a blockage, leading to an ischemic stroke. Recent studies suggest that other factors might also play a role, like inflammation in the body and changes in the heart tissue itself, which could further increase stroke risk. When someone with Afib has a stroke, they often face worse outcomes. They may have a higher chance of dying, more difficulty recovering, and a greater risk of complications like bleeding in the brain after treatment. This is partly because many Afib patients are older and have other health issues. Preventing stroke in people with Afib is very important. Doctors often recommend blood-thinning medications called anticoagulants, such as warfarin or newer direct oral anticoagulants. These medicines help prevent blood clots from forming in the first place. When used properly, anticoagulants can lower the risk of stroke by about 70 to 80%. In summary, Afib increases the chance of ischemic stroke because the irregular heartbeat causes blood to pool and form clots in the heart. These clots can then travel to the brain and block blood flow, causing a stroke. Managing Afib early with medication and controlling other risk factors is key to reducing this risk. If you or someone you know has Afib, it's essential to work closely with a healthcare professional to develop a plan to prevent stroke and protect brain health. Always seek personalized medical advice to understand your specific risk and treatment options.